For many patients, the only thing worse than one dentist is multiple dentists. In today's video, we're going to start a discussion on different types of dentists that you as a patient might commonly encounter and what they actually do. Hello and welcome to the Comprehensive Dentist Patient Education Series. My name is Dr. B, and today we're going to be talking about different types of dentists. The first type of dentist we're going to discuss is the general dentist. But first, how do you even become a dentist? In America, it is common for every dentist to complete a bachelor's degree prior to attending dental school. Dental school is 4 years long, and upon graduation, the dentist will receive a doctorate in dental medicine or a doctorate in dental surgery. A little secret, it doesn't really matter which degree the dentist gets. They're basically the same. Some schools use a more traditional doctorate of dental surgery, and some newer schools shifted to a doctorate of dental medicine. The training and what they can do when they graduate is essentially the same. In addition to a diploma from an accredited dental school, every dentist in the U.S. must pass their national board examinations and pass a licensure examination. Once they are licensed in the state they choose to live, they can then begin to see patients. A formal education after dental school is not required, but yearly requirements for continuing education are required by the licensing state or by professional organizations that the dentist is a member of. All graduates of dental school are general dentists. Some of these dental school graduates will go on to do more training in the form of a 1-year or 2-year residency that will quickly expand their experience and knowledge in dentistry. Other dental school graduates will go on to specialize in specific areas of dentistry, which we will discuss more in later videos. Now, I am a general dentist, and that is going to be the most common type of dentist that you will encounter. Now, a general dentist really is the subject matter expert of restorative dentistry. Restorative dentistry is the study, the diagnosis, and the management of diseases of the teeth, and the rehabilitation of the teeth, the bite, and the aesthetics of the smile. Or to put it more simply, this is a dentist who will treat cavities by doing fillings and restoring teeth to their intended function and appearance. Now, one of the cool things about being a general dentist is having the flexibility to do just about anything in dentistry. General dentists can treat gum disease and related issues, do root canals, make crowns, and do full mouth rehabilitations. They can treat children. They can do limited orthodontics and things like Invisalign. They can take out teeth to include third molar surgeries. General dentists can replace teeth doing things like bridges, implants, or removable dentures. They have training in diagnosing and treating various types of oral pathologies and can treat orofacial pain and temporomandibular disorders, commonly referred to by patients as TMJ. And just because a general dentist can do a large variety of procedures does not mean that every general dentist will do all of these procedures. Some general dentists pick and choose what types of procedures they will perform in their office. Maybe they only do procedures they love to do, or maybe they only do procedures that they know they are good at. And this can make finding the right dentist for you as a patient a little tricky sometimes. I've seen it countless times where a patient has an emergency and decides to go to the dentist that is either the closest or the only one who is open at 7 p.m. Depending on the situation, a dental emergency could have a few options to treat, or it may only have 1 or 2 options that are ideal and best suited for the situation in which the patient presents. For example, let's say a patient has some mild swelling localized around a molar tooth. The dentist does an examination and determines not only does this tooth have an infection, but the tooth has had very large cavity that has destroyed the majority of the exposed tooth structure. With very little tooth remaining, the dentist decides that the best thing to do would be to remove the tooth. Removing the tooth would eliminate pain and swelling from the infection and prevent the infection from getting worse. Only one problem. that specific dentist does not do extractions and decides to refer you to a specialist to get the treatment completed. Now you end up seeing two providers for the same issue. These kind of situations happen all the time and are not uncommon. If you are not sure what services a dentist or a dental office offers, you may be able to find out by visiting their online dental website, or you may need to just call the office and ask somebody. If you decide to call, I would call and explain your situation and ask someone if they think your situation could be entirely treated by that dental provider, or if they think you may need to go somewhere else. Truthfully, they may not have a good answer without looking at you in person, completing an exam and radiographs. But who knows? The point is, just know that every general dentist is not the same, and you may need to look around until you find someone right for you. For most things in dentistry, you will want to be seen by a general dentist first. The general dentist is the provider where you establish a dental home, so to speak. They will do an initial examination and recommend a treatment plan to get you back to good oral health and to take care of any elective procedures such as replacing missing teeth or doing cosmetic dentistry. This is the dentist who you will see for your biannual or your annual checkups, and it is the general dentist's office where you would most likely go for routine cleanings. Most cleanings are going to be completed by a dental hygienist who works for the general dentist. If you do not currently have a general dentist that you see, I would strongly encourage you to look around at dentists in your area and find one that you think would be a good fit for you and your family. In dentistry, prevention is always better than trying to treat something after it has started. Little problems can turn into big problems in a very short amount of time. And once a big problem occurs, the options to fix that problem can become complex and expensive. Think of it this way. Would you rather get your oil changed in your car on a regular basis, or never change it and have to buy a completely new car? Of course, changing the oil is an easier option. You use your mouth every single day, and it requires routine maintenance as well. So make sure you establish a dental home if you do not have one. All right, so that's going to be all for this video. Hopefully you understand a little bit more about what a general dentist is and what they do. In future videos, we will talk about some of the dental specialties and how they are involved in helping to treat and maintain your oral health. If you like this video, please hit the like button down below. If you enjoy this type of content, please consider subscribing to the channel. Also, if you have any questions that you would like for me to answer, place those questions down below in the comments section. I would love to make a future video to help you and thousands of other people better understand the questions that you have. Thank you for your time and attention, and I will see you next time.